Are we ready?
Let's go.
Fantastic. Well, hello everybody. Welcome to our webinar, How to Build Your Most Viable and Profitable Pivot Strategy and Nail It. We're so glad you could join us because we've been hearing over and over how important this topic is for health innovators. And obviously there's a lot of urgency and pressure to make sure you're pivoting fast, but still making sure you're covering all your bases and not missing any landmines. My name is Eran. I'm the Innovation Manager at Legacy DNA, and I'll be your host and moderator. And I'd like to introduce today's amazing speakers. We've got Dr. Roxie Mooney, the CEO and Head Innovation Strategist at Legacy DNA. Dr. Roxie has dedicated her career to helping health innovators figure out their most profitable and viable early adoption and pivot strategy. And her secret sauce is a repeatable, evidence-based method that helps innovators go from an idea to full market adoption. And what makes this method so powerful is that she built it through 20 years of business practice and 7 years of research, which included more than 500 peer-reviewed articles and 160 interviews with health innovators. She's also authored the international best-selling book, How Health Innovators Maximize Market Success. And our special guest, Eran Ofir, CEO and co-founder at Somatix. Somatix is a provider of wearable-enabled remote patient monitoring software for healthcare providers. And as a health tech innovator, Eran has some excellent insights to share with us about his own pivot journey and how he dealt with some of the biggest psychological obstacles that innovators face when they're navigating their own pivot. So we've got a couple housekeeping items here. First, we are respectful that everybody's time is blocked off, so we will be respectful of the 60-minute block. We've got live Q&A at the end, but you can submit your questions anytime. And of course, we'll be sending the recording and slides at the end of this. Now we've got a lot to cover in this 60 minutes. We've got a really exciting agenda. We're going to present a winning pivot strategy in 60 minutes. Today we'll discuss discovering the why, what, and how of pivoting, in innovator psychology, how pivoting is not bad, as you've likely been told, how to use your pivot or your pre-COVID market strategy as a baseline for what's next, map out your target market's changing needs and priorities, evaluate the different pivot paths you could take, and pinpoint the most viable and profitable pivot strategy. And I'll hand it off to you, Dr. Roxie.
Thank you, Erin, for that lovely introduction, and welcome, Eran. We're glad to have you with us today.
Hi, thank you, Dr. Roxie.
So I want to start off today's session with a couple of questions just to kind of level set and bring some context to our conversation. The first thing is, why is pivoting so important? Why are we even here today having this webinar? And I think that, market conditions are constantly changing, even when you're not experiencing a global pandemic. But as you probably all have experienced, that COVID-19 has certainly changed a lot of things for us. So customer needs have changed in a lot of ways. Certainly a lot of priorities have changed. I continue to hear that hospital systems are operating with their hair on fire. And, so their priorities have changed. And so that's just one example of this, evolving and very dynamic market. And in order for us to be successful with bringing our innovations to market, we have to make sure that we are pivoting where the market is or where the market is going. A couple of other examples of why pivoting is so important. As all of you know, we've had the entire country and almost world shut down, and that's closed the doors. So a lot of our traditional sales strategies and sales techniques have kind of rendered almost overnight ineffective. And so we're going to talk about pivoting strategy and how are we getting in front of the right target customers in today's new COVID economy. Also pitching investors. So this is another dynamic that's really changed. So if you were in the process of raising money, what investors are looking for is very different. How you tell your story is very different. Investors are looking for, believe it or not, COVID-proof businesses. So when you're pitching to them, making sure that those elements of the story are included in front and center are very important. So what is a pivot anyway? So it's funny, I've talked to a number of health innovators over the last couple of months, and everyone kind of seems to have a different definition of pivoting and also a different perspective on whether pivoting is good or bad. So I'll just tell you the definition that I use, which I stole from Eric Ries, the author of The Lean Startup. So he defines pivoting as when you change your strategy, but you did not change your vision. And I think that that's really important. If you change your vision, you basically have started a completely different company. And so we want to keep that in mind. It's only when you have the same vision, but you change your strategy that really qualifies for a pivot. And as you can see here, we've got many different types of pivots. You can pivot your financial strategy, your product strategy, your leadership strategy, your sales strategy, or your marketing strategy. Things are really noisy. Gaining attention and keeping attention was really difficult in this noisy world prior to COVID, but it's even more difficult to rise above the noise with everything that's going on today. And then the market strategy pivot is what we're going to dive really deep into today. And, most companies face obstacles when they are going to market. And I think that you'll be familiar with some of these stories. YouTube, believe it or not, YouTube started off as a dating website and pivoted. Flickr started off as an online video game and pivoted to a photo platform. And another one that we're really familiar with and probably use on a regular basis is Twitter. So Twitter started off as a podcast service and then evolved into the social network that we know today. So pivoting isn't necessarily a bad thing. And we have pivot stories that we hear very common. And one of the things that's really exciting about pivoting is that, it gives you an opportunity to redeem the failure and in learning what's possible through the pivot process. So today we have an exciting guest with us, Eran, and I'm going to pass it over to you so you can share with us your firsthand pivot story. You're on mute.
I'm on mute. Sorry.
There you go.
Okay. All right. Thank you, Dr. Roxie. Hi, everyone. My name is Eran. I'm the CEO and co-founder of Somatix. We do remote patient monitoring for healthcare providers. We work with hospitals, elderly care facilities across the care continuum, kind of independent living, assisted living, subacute short-term care, and nursing homes, and with rehab centers, drug and alcohol rehab centers. And this is after a pivot that we had around 2 years ago, or 2.5 years ago. And so maybe I should start with something that Dr. Roxie mentioned, which is that quote that, pivot is changing your strategy, but not your vision, which is, very true, meaning we always knew that from the get-go when my co-founder and CTO, Uri Schatzberg, invented the technology that we're using, that this technology is to be used by healthcare providers or by clinicians or by caregivers in order to improve the well-being of individuals. Because it enables them to intervene in real time based on the context of what a person is doing due to a wearable that we use, wearable devices. So that was always the vision. But the use case that we started with was wrong. And so yes, we changed the strategy in two levels. It was product level and market level, because some people, for example, are saying, we are going to pivot, we'll sell the same product, but to different industry. That's fine. Another type of pivots that I've seen is that we stay focused on the same industry. For example, we have 3 industries that we work with, elderly care facilities and hospitals and drug and alcohol rehab centers. So we stay on them, but we sell them a different thing. In our case, in the Somatix case, we've done double pivot. So we changed both the product and the market verticals that we are approaching in trying to sell the product. And pivot is not a bad thing, but you need to understand that while doing it, it's really a journey. Now, the reason that is a journey, Dr. Roxie, if we can, I don't manage to, yeah, we'll move to the next slide. Yes. It's a journey because you need to, first of all, admit your mistake, that something is not working, which is always very difficult for entrepreneurs, even if you've done it, you know, a few times. And but entrepreneurs, by definition, are kind of the alpha type, right? They lead, they drive, they're very self-confident. And now you need to, first of all, admit that there was a mistake. Something isn't working. So that's the first level. But you go through that psychological journey because you have to work with your investors. You have to work with your family. You have to work with your team, your own team, right? The company that you've built, and with your advisory board, and come to all of them and tell them, guys, we've built a product. In our case, it was a smoking cessation product that we were trying to sell to health insurance companies and to clinics doing smoking cessation. And then later we saw that even though it's a great technology and a beautiful product and the model, you know, on Excels and PowerPoints, everything looks great. But then we realized that what it really does is that it cannibalizes the revenues that they have from smoking cessation, because the product is that good that if they will use it, they won't make revenues for the smoking cessation programs that they run. So that's kind of a problem. So no one are buying it. Now it's even more confusing when everyone are saying that the product is great and where you are being selected to two kind of leading healthcare accelerators based on that product. And then you go and present in a startup competition in the National Conference of Employee Benefits Programs, right? That's our target market. And you win first place by, you know, a wide panel of judges. And so you're very confident with your product, but still it doesn't work in terms of sales, right? And getting to the market. So then you start doing that psychological journey, first of all with yourself, and then with your partner, and then with your team, and then you go to the advisory board, right? That group that you typically advise with, the people that you brought in order to that are experts in what you do. And eventually, after a process that takes a few months, you discover that you need to make a change. And then you start, if you look at the previous slide, then you see all these drawings, and we were sitting for days also together with our investors to understand what are the markets that our technology could fit in. And we came with the notion that the best market is remote patient monitoring, because we can detect gestures in real time, and we can understand what the users, the patients, are doing completely passively. So we get to the concept of what that product can do. But the problem is that it's a different product. So you need to change the team because you need a different talent. If we'll go back to the other slide. So you need to change the team, and you need to change the advisory board, right? Because the experts that you brought before are not relevant to the sectors that you will be trying to sell to now. And you need to go back to your investors, and this is painful, and tell them, well, we need to do another fundraising. This is painful because there is obviously a component of dilution there, right? When you kind of throw away all the funding that you had until now, and you start all over again in a way, because still all the backend and the tools that you develop surrounding your technologies are still there, but it's still you start building a new product from scratch, and it's also painful with the family, because with your spouse, and they went with you through that painful startup cycle, and then you come and tell them, well, the last 2 years, sorry, we have to do it again. So it's really a painful psychological journey that you make, but eventually it does good. Why? Because first of all, now you have something that hits the market well, which is the purpose of the business, right? That's the first thing. And the second thing, you have an opportunity here to gain a tremendous amount of trust, right? With your investors, with your team, and so on, because you were open enough and candid enough to tell them that I was wrong and we were wrong and what we thought about wasn't working. And now we ask for a second chance, and we do it this time differently, with a different product, with a different market. And guess what? And now we are selling and it's working and everyone are happy and so on. So this is why, and one last problem that maybe you should be aware of, if you have mentors, if you are in accelerators, and also the investors will tell you at the beginning, at least, you have to stick, with your idea. You have to be persistent all the way, and it's only a matter of time until you will tell the story in a way that will convince your audience and stuff like that. But again, I mean, until when? You can do it for half a year, for a year and a half, and you must set in advance the threshold after which you can tell yourself first, and then everyone else, as I described, guys, this is not working, we need to pivot. So I'll pause here because I covered a lot of ground.
You did. So Eran, you also faced an ethical dilemma. So very, I think probably pretty unique to your situation. You were in the middle of due diligence when you had this epiphany that your original strategy wasn't working. So, what was that like in the ethical dilemma that you faced?
That was terrible, because think about it. I'm waiting, at my hotel room for the next morning for the due diligence process, for the continuation of it. And then you realize that everything that you told them before, when you sold your investors, your potential investors, about the idea and the technology and the team and the advisory board, now you need to go and press the reset button. And you need to really have the courage, or kind of to go and tell them, guys, I was wrong, and here is another thing, which is an awful thing to do, right, in the midst of a due diligence process. Luckily, I had investors that were open to it, that could analyze the data the way I analyzed it. And they were doing that process of the brainstorming on the new product and the new markets together with us. And eventually, we even came up together with our investors. And this is not probably every investors that you will meet, but in this case, it worked well for us. We built together with them a roadmap of how the new funds that we got as part of our A round really lead us through that pivot process, meaning what could be reused and what needs to be changed in the team, in the advisory board, in the markets that we will be trying to sell to and stuff like that. So it is a bad timing to go to your investors in the middle of a due diligence and tell them, but it maybe tells that you have the right investors in the room, right? If they walk that road together with you.
Well, and not everyone would have even been that transparent. They would have just waited till the closed and got the money and then told them after the fact. So
no, that's unethical. No,
I think it speaks a lot to your character. So, I'm curious, when you started to have this realization that the original strategy wasn't working, did you feel like a failure, or did you feel like this was just par for the course? It's just part of the entrepreneurship journey. What was that like?
Well, you feel at the beginning, you feel that it's a failure, because you're trying to build a company, especially if you had previous experiences in building new businesses. So you come with kind of that ego and self-confidence and everything, and this is not working. So you have to feel the pain. If you don't feel the pain, then no sweat, no gain. And then after that, you start, you really start the process, and eventually you say, well, it was a good thing and stuff like that, but that's kind of in hindsight.
Yeah.
But my honest answer is that yes, you feel the pain, and you have to feel the pain. Otherwise, you haven't convinced yourself enough that you need to do that pivot.
Yeah. Yeah, that's really powerful. It's interesting because there's a lot of old adages that are out there in the entrepreneurship world of, fail fast. Fail is not a bad thing. It's a good thing. It's the gateway or the pathway to success. Is that, does that really resonate with us, or is that just hyperbole for other people until we're experiencing it firsthand?
Yes, everyone are glorifying failure in the last 2 years. Every book that you read
Right.
about how good is to fail and so on. So it's a process, right? It's a process that ends up hopefully in a good place. At least for us, that was the case. But failure is not fun. Let's admit it at all levels, because you need to go to so many different type of stakeholders and face that situation with them with all cards on the table. So that's the real truth.
Yeah. So did you ever think about just giving up when the original path didn't work, or was it that you were always just persistent and determined and I'm going to figure out what this right strategy is?
No, we didn't. Well, no, we did not think to give it up. No, that
Yeah.
wasn't on the table. Even we said, whatever it takes, even if we go back to be like 3.5 employees, starting all over again, looking for new investors and everything, this is what we'll do, because we were so convinced of the transformational technology that we bring to the market. And when we met in 2 US healthcare accelerators with representatives in customer immersions, kind of with representatives of the 4 Ps in healthcare, the patients, the physicians, the providers, and the payers. And we got the response about the tools that we have and about the technology. We knew that we have something strong in our hand, but it was just the product market fit wasn't right, because we did not understand the second part, what comes after the product. Like, we have a great product, but who is going to pay for it and why? Meaning, it's one thing to have a great product and to build the MVP and to tell the stories of that product and to even to prove it clinically, right? With peer-reviewed journals and everything. So it's working. That's one side of the equation. But the other side is who is going to pay for it in that, 4 Ps value chain. So that's really where it fell.
Yeah. And winning awards is not enough, doesn't pay the bills. Winning awards is not really evidence of product market fit at all. Yeah.
Right.
I hear that over and over again. Well, thank you so much for sharing your story with us. I appreciate it. And I think that everybody that is, attending the session today will be able to, glean a lot of value from your transparency and candidness about, the difficulty of what we're talking about today and what it's like to really experience it firsthand.
Thank you.
So, continuing in our presentation today, I don't want to ever give the impression that pivots are really just for startups. You might be surprised to know that even large organizations are pivoting. And really, it's just par for the course that we, even mature, established brands have to pivot to stay relevant and to stay viable in their markets. And so one of the examples that really just came out last Friday is Starbucks. They just announced their pivot. You may or may not be familiar with it. So they announced that they're closing 400 of their brick and mortar stores and that they've launched their pickup facilities and partnered with Uber Eats. And what's I think is really fascinating about their story is that, you know, you might think that the global pandemic is what's triggering a lot of this this pivot conversation, and it is in a lot of ways because it's changed customer needs and customer priorities and a lot of different market dynamics. But when you start to you know, dig into the Starbucks pivot story, you realize that this was actually something they had been considering for a long time, and it wasn't something that they made like, this wasn't an emotional decision. This was a decision that was based upon data. So for 2 years they had been looking at their data to demonstrate that more and more customers were relying on the drive-through and to go Starbucks products as opposed to coming into the cafe. And so, you know, I think that what's really important here and what we've been talking about and what I want to reinforce is, you know, Starbucks' vision didn't change. They even talk about it in their announcement that, you know, their story is built around being a third place, but that third place changed. The third place used to be in the brick and mortar cafe, right? With your earbuds on and, you know, kind of working in the office and sipping on your, you know, whatever frappuccino, but the third place is moved, and the third place is really wherever the consumer is, and it could be at their home, their office, or in their car. And so this, I think, is just a really timely example of another larger institution that is pivoting and allowing the data to really drive that decision making in a powerful way. So have a vision beyond your resources. So this is, I think, really important. A lot of times innovators think that I don't really have a whole lot of funds to work with. I've really got a limited amount of money in my bank account. And so I need to really pare down my vision to match my bank account. We will never be successful if our vision is only as big as our financial resources. So I just want to encourage everyone on the session today is that as we're starting to work through this market strategy exercise and you're thinking about the implications for your company, and when you kind of leave and you go off and you do this on your own and you're mapping it out, think big. You know, have big faith in you and your team and your capabilities. I use Amazon as an example. When Amazon first launched their company, they probably did not have the resources to be the largest global e-commerce solution that we have on the market today, but they still had the vision for what could be, but they started off with a different business strategy or market strategy in being an online bookstore, and so then grew into that larger vision over time. So I just want to encourage everyone, when you're going through this process, to make sure that your vision is really beyond your resources. So this is getting into the meat of what our presentation here is all about. Is I want to spend some time telling you my 5-step formula or framework that I use with clients, so that way you can you know, nail your own profitable and viable market strategy. And we'll dig into each one of these a little bit, but it's 5 steps. So the first step is going to be mapping out your pre-COVID market strategy. The second one is going to be mapping out those 3 different pivot scenarios or paths that you could take. Once you map those out, then you know, we need to evaluate them and rank them and see which one. You'll have a number of different paths that you could take, and everyone's pivot scenario or options are going to be different, right? It's not going to be a one size fits all. And so you need to work through this process, spend some time with it. Don't rush through it. There's a lot of wisdom in wrestling with these ideas and coming out to the final outcome. Then once you evaluate your different options that you can take, step 4 is really identifying, okay, this is my new pivot strategy going forward. And then number 5, which I think is really important and gets often overlooked, is once we have our new pivot strategy, we know where we're going. Majority of the time that's based upon a lot of assumptions that we're making. An example of that would be is maybe I was a B2B company to start with, and as I've gone through this exercise, I've decided that it makes sense for me to pivot to a B2B market strategy. well, I'm making some assumptions, and we're talking about healthcare here. So I'm making some assumptions that consumers are going to be interested and willing to pay for my healthcare solutions or my devices, whatever it may be, pay cash for it, as opposed to going through the commercial insurance. And so that's, you know, that doesn't mean that you have a bad strategy. It just means that that's an assumption that you're making. And as you go out into the real world, it's something that, you know, needs to be tested. So this is the 5-step framework. I'm excited to dig into this deeper with you, and let's keep going. Okay. So step 1, as you are mapping out your pre-COVID market strategy, I want to say this. So I don't know the exact situation for everyone that has joined us today. If by chance you don't have a market strategy to use as your baseline, then you want to make sure, like, this is an incredible learning opportunity for you, and I encourage you to stick with the end. I know that you'll learn a lot from this presentation today, but you can't pivot, change directions without having an original market strategy. And so if that is the case, and you know, want to raise your hand and say, that's me, feel free to put your information, your name or your email address in the chat. We have resources that we've developed over time to help people with developing their initial market strategy, and be happy to share those with you. Okay, so back to identifying your pre-COVID market strategy. I think this in itself is an exercise for you and your teams to really map this out and think through because there's so much change that's happened in the last couple of months, to think back of, like, who were you before COVID even took place, and how you were going to market, you know, your customers, your value propositions, how you were, you know, who, like Eran said earlier, who's paying for it, you know, what was your business model and how you were making money. And so if you have not already downloaded the Pivot Strategy Builder, Eran's put that link in the chat for everyone. You can download it now, or you can download it later, but it's a free tool that we're giving away to help you, and you'll see all these questions that we're talking about today, this entire process. It's all mapped out on that resource. So within your market strategy, there's these different key components, right? Your customers, your value proposition, channels, you know, how you're distributing it, your revenue streams, key partnerships, activities and resources, and all of these things are kind of all interrelated with one another. So you want to make sure that you take the time to really map out and don't skip any of these important questions out. So step 2 is mapping out those different scenarios. And what's beautiful about that Pivot Strategy Builder that we created for you is that side by side, you will have your pre-COVID strategy next to, and it's the same set of questions. You're just looking at it through a different lens, right? So what's happening today? And I would encourage everyone, and you know, a lot of entrepreneurs are already futurist and kind of thinking ahead anyway, but Wayne Gretzky's quote is, you know, don't skate to where the puck is, skate to where the puck is going. So as you're mapping out your 3 different scenarios, I would encourage you to not think about, you know, how conditions have changed today, but, you know, try to anticipate where the market is going over the next 6 months in the next year, and the different scenarios or options that you have that you can map out going forward. So something to keep in mind is that if you decided that your product was needed to change, you needed to add some different features and functionality, or maybe that you needed to strip it down, as you're mapping this out, think about what that means. More than likely is that if you're doing a modification to your product strategy or your solution itself, then you're going to need to evolve your value proposition. So this tool is just really helping you think through how these different elements of your market strategy are all related. And as you are, you know, mapping this out, you know, I want you to keep in mind that we've given you space for 3 different scenarios, but don't feel bad if you don't have 3. Don't force it. It's okay. If you've just got 2 that you want to compare and map out here, just go for it. So after you've mapped out the different alternative scenarios, you want to kind of take a look at what are the patterns in between who you were before COVID and kind of where you can go going forward. What are the pros and cons of each one of these new pivot paths that you could take? You know, be mindful of some blind spots. So as you're mapping this out, you know, I want to encourage you to have a thinking partner with you, maybe somebody that is external to the company that can kind of help poke holes in these different scenarios that you're mapping out. I think that that is really important, because a lot of times we can be so fixed on our original strategy that it can keep us blind from some of the new opportunities that we have before us. And certainly as you're evaluating these, you know, you might uncover that you've got that this opens the door for a new relationship that you didn't even realize you had once you change your product or once you change your value proposition. And so, you know, those types of factors will help you identify which is going to be the most viable. And think about this too, as you're evaluating these, you're looking at it, you know, maybe there's some criteria in your different pivot paths that you can take that helps you get to market faster, or that might be more profitable over the other. I would encourage you to not just use profitability. There's a lot of things that could drive your decision making around what's going to be the best path for you. And like I said, take your time through this exercise. You know, as entrepreneurs, we have a tendency to be really fast and kind of make decisions really quickly and feel like that window of opportunity is quickly closing. And we want to make sure that we don't get outsmarted by the competition. But I do want to encourage you to take the time. It could take weeks, it could take a couple of months to really figure out what's going to be the best path for you going forward. And so let's just keep going. All right, so let's start off by taking a poll question. So if you look at your screen, we've got 2 questions for you to answer. Where are you right now in the pivoting process?
It's probably for me, right?
It's for everyone.
Okay.
Yep. So where are you in the pivoting process?
Okay.
And, you know, based upon what we're starting to talk about, is this something that you think would be useful for your company? I think we've got a few more that are voting. I'll give you about maybe 15 more seconds to get your answers in. Close it out at 1 minute. All right, we've got some others that are coming in. Fantastic. All right, so this is the results. So it looks like majority of the folks that are on today's session are exploring all kinds of different options. And that makes, you know, that makes a lot of sense, because there's, you know, a lot of this is not so easy or so cut and dry. And I'm glad to find that most people are finding this really useful. So stick with us. We've got more coming. All right, so let's keep going. So step 4 in your market strategy. So, you know, the key here on step 4 is it is really helping you with the scoring process. We've got a built-in formula into that builder document that is helping you quantify what number of pros, what are the number of cons, and then, like I said before, you know, you get a chance to rank the viability and rank the profitability of these different pivot scenarios, and that will help you come up to a score for each one of them that should indicate what is the best path for you. And what's so powerful about this stage is once you've done the work of the previous stages in this formula, then you can really strike hard and strike fast with your new strategy with a lot of confidence and a lot of clarity, because you've wrestled with this for a while. You've taken the time to do the work. And then in step 5 is, where I talked about where it's really important to identify your assumptions. Sometimes we have confirmation bias, and we are really just, we get so committed so quickly to whether it's our original strategy or our new pivot strategy that we don't want to veer from what the market is telling us. And so using the Starbucks example, it would be really easy for Starbucks to just continue and stay the course and ignore the data that was coming in that showed that customer demands or consumerism was really shifting their value proposition, and ignored that. And so, we want to make sure that we are testing those assumptions in this process. And I also want to remind everyone, there's a saying that a good colleague and a friend said. He uses this term of an 80-80 rule, which is kind of confusing because you normally think of it as an 80-20 rule. But the 80-80 rule is that we should only be 80% confident that our strategy is going to be 80% accurate. I don't know if that makes sense to you or not, but 80% confident that our strategy is 80% accurate should feel normal. So if any of us go through this pivot strategy process and we feel like we've nailed it, we're 100% sure, there's no doubt in our mind, like there's a part of that where you want to have confidence in the direction that you're going, but you don't want to continue and wait to launch your new pivot strategy until you've got it perfect. Otherwise, you will miss the opportunity. So, I think that part of the, what I want to get across here is that if we only feel 80% confident, for us to know that that's actually really normal. Okay. So I think that, health innovators are, a real special breed, and not because you're an innovator or an entrepreneur. It's because I think that there is so much power in the work that you're doing. You really are impacting lives. It's not like other industries. Our family, our friends could very well be on the other side of your innovation one day and needing your solution to either improve their quality of life, extend their life, or even save their lives. So I want to encourage everyone to stay the course and, keep innovating, because we need you. And now is your time to really transform healthcare and leave your mark on the world in a really powerful way, as the healthcare industry really does finally transform because of this pandemic that we're facing. So I want to talk about an offer that we've put together. So I know everyone here on the call today wants to identify what is their best strategy to survive and thrive in this new COVID economy. And so we really quickly, after I started hearing this conversation a couple of months ago, put together this really comprehensive COVID Proof Your Business pivot kit. And, the clients that I work with, we've got here on the screen here the retail value of each one of these things, and it's so comprehensive. The team put so much work into this. We've got these 2 really powerful guides. We've got these builder worksheets, these cheat sheets that help you with virtual selling, that help you with pitching investors. Everything is made online, so it's really easily accessible for you and for your teams. And then also we've got this action plan, right? Because we can talk strategy and we can develop strategy all day, but it's only valuable when we put action behind it. And then it includes, the kit includes this investor presentation template, which really is very powerful in itself to help you really be able to tell your most compelling story to investors. And when COVID happened, the team and I talked, and we said that, a lot of people can't afford the $20,000 that this cost. So we drastically reduced the cost to $19.95 to really be able to help everyone and in the industry. And you've seen there's been a lot of companies that have, made their tools and resources available for free or at these really low bottom prices like us today. And so my gift to anyone that is attending with us today is to offer this to you for the next 24 hours for only $5.98. So the clients that find this most valuable are the ones that are really struggling with selling in a virtual world, maybe struggling with how to tell their story to investors going forward, need a framework to go through this process as opposed to kind of willy-nilly making sure that there's no pivot opportunities that are left on the table. And I think the other thing is bringing the team along with you in the new strategy. We see that sometimes the innovators, the CEOs of the company are such visionaries and futurists that they're way ahead of their teams. And so this entire package really becomes a powerful tool to help make sure that you're not running 100 yards ahead of your team, that you're able to use this to bring them along with you. And then, you know, kind of feeling like it's that, you know, late night special. We've got a couple of extra bonus pieces that we're including in the kit for all of you that buy the kit in the next 24 hours. And you see the link here. So one of them is so powerful. It is, you'd be surprised on how many companies, both big and small, have innovated and pivoted in the most incredible ways during these global crises. So we've selected 11 stories that we've highlighted in this book about companies that have pivoted during the Great Depression and the Great Recession. And I know that you'll find them very inspiring and encouraging. And then this other piece is just, I know that so many people's sales strategy has been completely dismantled with the shift of doors being closed and conferences being canceled. And so we put together this other virtual selling tool following this 5A framework that we use with our clients. And all of this is made available to you for that one price of the $598. So if anybody is interested, please put your name or your email address in the chat, and Eran will be sure to make sure that you get this. And I'm going to open it up to questions now.
Okay, fantastic. Well, Dr. Roxie and Eran, we actually have a couple questions that came through. First is, how much money do I need to raise for my pivot strategy?
So Eran, I'm going to let you take that question.
All right, thank you. Basically, you need to do the same calculation that you had with your previous product, with the exception that you need to take off costs of tools that you already developed in terms of technologies and stuff like that, that you can reuse. But it is a significant amount, because if you, for example, instead of employee benefits programs and the insurance companies and payers, we started that we go to healthcare providers, which is a completely different segment of the healthcare market. It means that you need to replace your salespeople, right? Because it's not the same, guys.
Yeah.
So that's one thing. You might need to replace some of the team, because the talent, the IT talent that is needed to develop the new product is a little bit different. So, you know, hopefully you can preserve most of them or all of them, but that's not always the case. And then you need to redo the advisory board. So basically you need to do the same calculation for the next 2 years, because likely this is what it will take you. If it's a complicated product, you know, you will get to an MVP within a year, and then you'll start selling and stuff like that. So it's not a small amount. That's why kind of you need to, this is why I talked before about the pain in refunding the company.
Mm-hmm. Yep. Absolutely.
And we have another question that says, I feel like there are a couple areas we can pivot, but I don't feel like we need to pivot our entire business model. Can a partial pivot work?
Absolutely. And I think that that is a, you know, a very astute observation. So and it really reminds me to reinforce this. Not everyone needs to pivot. I think the value of this for every organization to go through is to verify that, right? It is that there will be some people that go through this builder document that we created, and they're doing this checks and balances, and they put their pre-COVID, they're identifying if any needs have changed, and they're like, no, customers still need our solution. It's still viable. The priorities are still there. Maybe we just have to wait a couple of weeks for the doors to open up. So your business model is still intact, and you don't need to change your market strategy, which is what we've been talking mostly about. I think that, you know, when we talked about earlier, when we were showing the 6 different, I'm going to just pop back over here, these 6 different lenses, that some companies will find that the market strategy doesn't need to change. I would imagine that almost everyone needs to pivot their sales strategy. If you've pivoted your product, it's very likely that you need to pivot your messaging strategy. In being with everyone transitioning from face-to-face to almost all digital overnight, it's very likely that your marketing strategy needs to pivot. But I think that it's not a one size fits all, which is what you're, you know, touching on, is that, you know, going through the exercise. And I think it's important to note that this pivot kit includes not just the market strategy and this builder document that we gave away for free, but it includes this whole framework and worksheets to go through these 6 different pivot lenses. So it's 6 key areas of the business to make sure that you can identify and put a strategy and a plan in place for any of those places that you might need to pivot. Great question, though. Glad you asked it.
Yeah, and we've got another, and this says, we've got some leaders who do not seem to get that we have some pivot opportunities that we should go after. How can we open their eyes to a pivot being a good tool and not an admission of failure?
Ooh, Eran. So I have some thoughts around that, but I'm going to ask you, since you've experienced this firsthand and you are essentially that leader.
Well, simply ask them the questions if they are trying to, if they manage to sell the product. If they are not, I think that for a while, right, not for 2 months, but for a year or more, then I think that the answer is pretty obvious. That's meaning, yeah, they can continue doing the same thing for the next 5 years and believe that eventually it will sell if they have the funding available for that. But that's probably not the healthy course of doing it.
Yeah. Yeah. And this is a shameless plug here, but invite them to our webinar. Send them the recording of this webinar as a follow-up, and hopefully that will help them.
Or buy them the framework.
Yeah, or buy them the framework. Exactly. And tell them that you want to go through this exercise. You know, there are a couple of indicators around product market fit. And it's interesting, you know, the lack of market need is the #1 reason why innovators fail. And product market fit is the #1 indicator for success, right? And so if your offer is not resonating with customers, if word of mouth is not spreading, and that you know, your sales cycles are really long, you know, you've got a lot of opportunities, but nothing's really closing, those are all indicators that you haven't reached product market fit. And those should be some kind of painful red flags to kind of poke us to say that, hey, we maybe need to relook at this. And I think the other thing is just to kind of be transparent with them when you're having that conversation about that psychological conflict that Eran talked about, that I think is just so powerful. Is you know, failure is when we ignore all the evidence that things have changed and we just kind of stay the course. And Eran and I have talked about this before. You know, what is that balance between I'm determined and I'm persevering, and you know, everyone says it's not going to work, but I kept on going and eureka, I got there, versus when am I so, like, that perseverance and that determination just turned out to flat ignorance. Right, Eran, anything to add to that?
No, that's good description.
Yeah.
And of the process that you need to eventually admit that something needs to be done. Even if you know, no one from the outside is telling it to you, because they were all so sold into your vision and your product they're simply waiting.
Yeah, and sometimes we get a small amount of sales or paying customers,
Yes,
and that actually ends up being a death trap because that small little indicator of progress or success, where we might have like an okay strategy or an okay product, prevents us from the best strategy, the most viable, the most profitable that we could get to.
And awards and recognition and grants and peer-reviewed articles about, the clinical success of the product. So you have all these, good inbound traffic, and yet you need to do a pivot.
Yeah. Yeah. I would say the number one indicator for product market fit is when you've got loads of money that is piling in from paying customers into your bank account. That's when you got product market fit.
Dr. Roxie, with about 4 minutes left, I want to sneak this last question, and this is a great one. This says, with the second peak of COVID-19 possibly here, how can I convince my team to invest the time and money in a pivot? It looks like they're heading back into panic mode, and I don't think our business can do another 3-month pause on everything. And then it's added on saying, and to restate, how do I convince my board to invest time and money? They are the holdup.
Ooh, Eran.
Yeah, that's a tough one.
You have a board that you report to.
Yes, of course. They are my managers.
Yeah.
So I think that, you need to come in a very open way to the board and present to them what is working and what is not working. How do you think that the next 12 months will look like? But don't just present the problems and the challenges, but it must come together with the mitigation plan, right? Mitigation. What is it that you suggest in order to mitigate the situation? What are the challenges and how you address them? And if a pivot is included there, then suggest it at least as an option, right? You don't have to have the presentation only about the pivot, but if you present 3 options to the board, of which one is staying the course, a second one is hibernate until this COVID-19 situation will end, and then we can go back to business. And the third mode is let's do a pivot in order to adapt ourselves. At least put the discussion on the table. There is no point of hiding from it.
Yeah.
And I think I can sneak in even one more question here. People may have some really good questions. I want to make sure we cover it. This one says, can we just change from B2B to B2C since a lot of stores are closed?
No way. No, sorry, I have to stop. No way. Oh, I hear it so many times from people that are saying, yeah, well, I was B2B, and now with the same product and with the same team and with the same tools and everything, I'm just going to switch and sell it direct to consumer, whether it's D2C or B2C and so on. I advise to startups, and I'm doing some mentoring and stuff like that. And this is a really common question. And oh my God, it's completely different thing. Everything is different, meaning, and trust me, you don't want to come to your board and tell them I'm just doing B2B to B2C. You will look really not serious, because that the team needs to be different, and the marketing and the funding and the product and wow, it's basically building a new company. Meaning I've seen very few cases of companies that just flipped with the same product, right? From B2B to B2C. This is, from my perspective, it's a big no-no, unless, again, you went to the board and you suggested them that we'll dump the B2B market and we'll go to B2C. By the way, we even went through that exercise and how much funding will be needed in such a scenario. We will obviously need to replace almost the entire team, right? Because the user experience team needs to be different, and the marketing team and the sales team, and definitely the advisory board, right? Bring along people that were experts in selling to B2C. So moving from B2B to B2C is like, changing the course of a big cruiser. It's not something that you can simply do.
Yeah.
That's
Yeah, absolutely.
this is a big one.
I love your reaction to that, Eran, and how fired up and passionate you are. I can tell that you've been asked that many times.
Oh, yes.
Roxie, I'm watching the clock. I want to be respectful of the time, but I thought if you can give maybe a 45-second, 60-second answer to this one last question, I think it'd be a good way to end. The question is, we know we need to pivot, but what do I need to pivot first?
Yeah. So, I think that the key to that is that it's going to be different for everyone. And that really is the power of the Pivot Builder document that we gave away for free, and the power of the Pivot Kit that we're selling today. Going through that exercise will give you confidence and clarity on exactly what you need to pivot and in what order. That's not something that anyone should ever guide you on without doing the work first. Yep.
Fantastic. Well, we have officially hit that hour mark. And so I want to thank everyone who participated today. Fantastic questions that came through. You do see the link down at the bottom of the screen if you want to visit to take a look at that kit. If you are interested in the pivot, then that would just be legacy-dna.com/pivot. Dr. Roxie Mooney, thank you so much. And Eran, thank you so much for your time today. We really appreciate it. We appreciate all of the attendees that showed up.
Thank you.
Recording and slides are coming via email.
Thank
Excellent.
you. Really
Have
enjoyed
a
it.
fantastic day.
Thank you everyone for joining.
Thank you. Bye-bye.